The National Health Service was launched on the 5th July 1948 and since become the world's largest publicly funded health service. Although perhaps well respected today, its initiation was hugely contested by the Conservative Party as well as many consultants and doctors. Even though the service is well regarded as providing quality health service based purely on one's clinical need, the service is undergoing fundamental changes. With the cuts in its funding as a consequence of austerity, one could strongly argue the NHS is at breaking point.
While the NHS guarantees free healthcare to the citizens of the UK, still many examples of privately owned healthcare goods and services are seen to exist. One such example is the Portland Hospital for Women and Children.
Capitalism, as defined in the economy, is an economic system in which three key institutions play an important role: private property, markets, and firms. Many schools of economic thought would agree that markets work best when they are free from outside intervention. When economists agree that markets work best under a laissez-faire policy, it's because they recognize that markets need incentives for innovation. The discovery of new medicines can occur in a much more efficient manner if pharmaceutical companies are allowed to price their goods as they see fit. Systems in which government policy keeps prices artificially low or interfere in intellectual property, there's less of an incentive for firms to develop new medicines, as potential profits will be reduced. Similarly, markets need competition to be efficient. Where markets are interfered with, as is arguably seen with the NHS, efficiency within producing firms may be lower than if they were exposed to competitors. This also accounts for a lower quality of service, as monopoly firms do not need to work hard to attract repeat business. Consumers also could benefit from a privatized healthcare system insofar as they would be presented with more choice that could cater to their specific needs. Positive externalities could arise from privatization as it becomes in the interest of the general population to remain healthy, avoiding the cost of healthcare and medicine.
The privatisation of healthcare has its disadvantages. With private firms supplying healthcare services and products, prices may not be justifiable due to the profit-driven nature of such firms. Milan Pharmaceuticals were recently called into question by the federal government regarding the overpricing of their EpiPen product. Their prices have increased by 400% over the last 9 years, and Milan eventually settled for $465 million. Another such case involving Turin Pharmaceuticals, whose CEO Martin Shkreli had increased the price of Daraprim, a drug used to treat HIV patients, by more than 54 times its price overnight. Such profit-driven firms may also look towards cost-cutting approaches, cutting corners on safety and testing. With healthcare being a fundamental necessity in life, should governments play a bigger role in regulating healthcare?
The Singapore government blends the notion of individual responsibility and government control through a financing system of government subsidies for primary healthcare, hospital services and pharmaceuticals, along with individual savings accounts. This means that the price burden of healthcare is constantly shared between consumers and the government, while still ensuring that healthcare is made affordable for all income groups. At the same time, the government gives private institutions calculated amounts of space to innovate and develop, and even heavily invests in biomedical research. The engines of efficiency and innovation are driven by private institutions, while public hospitals offer significantly lower costs, both forces keeping one another in check. While every country's dynamics are vastly different, our team believes that maximum welfare can only be generated when countries find their own middle ground.